Hi, and welcome to the TennCare Patient-Centered Medical Home Program Introductory webinar. We'll get started in a few seconds. All right, I want to say a special welcome to all of the Wave 3 providers who are tuned in today. Congratulations and welcome to the TennCare PCMH program. My name is Meredith Gonfeld, and I am the state lead for the PCMH program. And I serve as the state's main point of contact for the program. So if you have any questions or need access to information or resources for the program, or you're just not sure who to contact about a particular issue concerning the program, please feel free to contact me. I will show you my information at the end of the webinar so that you have my email address. So let's get started. A few housekeeping items. Everyone's line is currently muted, so if you have any questions or comments, please enter those in the chat box and we'll get to those. Also, if you are interested in reviewing this webinar or listening to the recording later, or if you have staff who are not able to attend and you would like for them to reference this webinar in the future, we're going to be posting their webinar slides as well as the webinar recording to our website, and we'll let you all know when those are live. So today's webinar, we're going to be walking through key areas of the PCMH program, and the format of today's presentation mirrors the format that's included in the provider operating manual. So as you can see, listed are the table of contents from the provider operating manual, and I'll also copy and paste the link to the webinar, to the provider operating manual in the chat box for you. If you would like to actually open the document as we go through the webinar. And so each section of the operating manual will touch base on the programmatic information that's included in each of those sections. Give me a quick second to copy and paste the link for the operating manual. All right, so just drop it in the chat box. Feel free to open that if you'd like. I do strongly encourage you to review that operating manual as it is your go-to guide for the program. It includes valuable information about the program design, program expectations, and whenever we put in any regular updates, that manual is also updated. So please review that and also share your staff as well. So before we actually hop into the program content, I did want to share some more background information on the origins and the purpose of the TennCare PCMH program. So here in Tennessee, we are taking a strong role in changing the incentives for providers so that better care and more efficient care is rewarded. Our goal is to pay for outcomes and for quality of care in ways that reward strongly performing providers. And we believe that by aligning on common approaches such as investing in primary care and enhancing how behavioral health is integrated in the health system, we can make some sustainable progress towards sustainable medical costs and improving care. So many of you are familiar with the TennCare Healthcare Innovation Initiative, THCII, some call it, and that's what we have implemented through 3 strategies to achieve these goals. And so one of the strategies is the primary care transformation, and that's the strategy under which PCMH lives. So the PCMH program was launched January 1st of 2017, and this is the program that is aimed at paying primary care providers for prevention and for maintaining their patients' health over time, as well as for coordinating care that they receive from specialists. We also have the Tennessee HealthLink program, which some of you may be aware of, which is a value-based payment approach to paying for behavioral health care coordination. And the PCMH and the Tennessee HealthLink program do work hand-in-hand and complement one another, and this is part of our primary care transformation strategy. The other 2 strategies under THCII are episodes of care, as well as some value-based payment approaches to long-term services and support. But for today's webinar, we're going to be focusing only on the PCMH program, the program in which you all are participating in, and what participation in this program means for you as a provider. So if you have your operating manual open, we're in Section 1. So Section 1 is just a general overview of the TennCare PCMH program and the model. And under our program, we are looking for PCMH organizations who are committed to providing some just key services and functioning in key roles for primary care. So we're looking for organizations who have team-based care. They're focused on population health management as well as coordinating care for their members and care transitions and other functions. And to support this model within our program, we have several different ways in which we support the PCMH providers. There are financial supports, which we'll get into later, as well as training opportunities and ways in which we provide resources to help practices in their transformation, as well as we provide data through reports as well as the care coordination tool. And all of these different areas of support we'll get into in more detail in later slides. But all of this we've designed within the TennCare PCMH program to benefit our patients and the providers and the healthcare system overall through outcomes such as increased quality of care, increased collaboration between providers and health plans, as well as enhanced chronic condition management and other various benefits. So if you flip to Section 3 of your operating manual, so which members are included in the PCMH program? So we designed the program to be as broad and as inclusive as possible. So all TennCare members enrolled with the MCOs are eligible for the program. There are a couple of exceptions, such as covered kids, but generally the approach is to be as broad and inclusive as possible for adult and children populations. So for the TennCare PCMH program, all TennCare eligible members are attributed to a PCMH each month that to the PCMH with which the associated member has an active PCP. And so all of the eligible TennCare members that are attributed to your practice on a monthly basis are included in a calculation for a monthly activity payment, which we'll get into later in the payment piece. But on a monthly basis, those members are attributed to your PCP or your PCMH based upon PCP assignment. Also, I'd like to point out that you will have access to a platform called the Care Coordination Tool, which will enable you to see these attributed patients. So I would like to point out that when you first get into the tool, you will see members in the tool that you may have never seen before. And these members are on your panels because they have a PCP attribution with the provider under your tax ID. And that is because one of the purposes of the TennCare PCMH program is to reach out to all members and take a population health approach for these members. And I also like to point out that there are some members who are not included in your quality and efficiency outcomes because they have different exclusions that we have for the program, such as having third-party liability or those with extended nursing home stays. So if you want to find out more information about some of these exclusions or just overall the attribution methodology for the PCMH program, please review Section 3 of the operating manual for more information on those items. All right, so the fun part. What services are we asking for PCMH providers to provide? Under this model, we're looking for PCMH organizations to provide team-based care, adopt patient-centered access and patient-centered approaches to their workflows and just operations, provide enhanced care coordination and other key services. And to ensure that PCMHs are achieving these principles and operating under these principles, we have a requirement for each PCMH organization to maintain or achieve PCMH recognition through NCQA. And so in the next couple of slides, I'll get into more information about that NCQA requirement. But essentially, we're looking for providers who are going to be upholding a lot of the principles that are listed on this slide. So Section 5 gets into the program's NCQA requirements. So for those of you who are not familiar with the National Committee for Quality Assurance, this is a national accrediting body, and NCQA has a PCMH recognition process by which they evaluate organizations on key PCMH functions. Some of those were listed on the previous slide. So organizations who undergo this recognition process are evaluated in various areas as far as the PCMH model goes. And so those practices who achieve recognition are identified as having a strong commitment to continuous quality improvement and having a strong patient-centered care approach. So for you all who are participating in the TennCare PCMH program, as part of your participation in this program, you are expected to either maintain current recognition or pursue recognition for all of your sites. So it's important to note that this recognition that NCQA assesses you for is evaluated at the site level. So if you are a multi-site organization and you have more than one site under your tax ID, it's important to note that the recognition will be assessed at those individual site levels. So you might have a combination of sites where some have current recognition, some were not previously recognized, or some have a current recognition that's set to expire. So it's very important to know the recognition status of each of your individual sites, because the expectation is that if a site has NCQA level 2 or 3 recognition, they're automatically meet our requirement for the program until that recognition expires. So when that recognition expires, those sites must transition to NCQA 2017 standards, so they must undergo the recognition process under the 2017 standards to maintain eligibility for the TennCare PCMH program. Also, if you have sites without any previous recognition, or you do have sites that are currently coming up against their recognition deadline or it has lapsed, those sites are required to pursue recognition under the NCQA 2017 standards by the deadline that we've set here at the state. So on the slide, you'll see the first time point for this timeline that we've set. So the first step, if you have sites that need to get recognized, is what we call enrollment in QPAS. And so QPAS is the portal through which you'll do a lot of your recognition activities with NCQA. It's an NCQA portal. We are asking that at least one user from your organization create an account in QPAS by May 31st. And we'll send out more information about getting started and getting enrolled in this whole process, as well as your Navigate coaches and MCO representatives will be available to work with you throughout this process. So we'll be sending out more information about the recognition process and what you all will need to do. But the first step in this timeline, as I said, is enrollment in QPAS. And so what enrollment entails is creating those user accounts and then uploading general information about your organization, such as clinicians, site location, addresses, phone numbers, et cetera. So that's what the enrollment piece of the recognition timeline entails. So the second step is the payment piece. So the state is funding all of your recognition activities for your sites, and we will be sending out a discount code for you to use. It's a field in QPAS that you'll have to insert this discount code, and we'll send you that discount code. And so we're looking for you all to submit payments for each of your sites by June 30th of this year using that code. And so what that essentially does is when you submit that payment code is you start the recognition clock. So depending on your readiness and your familiarity with the NCQA recognition process, your recognition timeline could take up to 12 months. It could be less depending on if you have previous recognition or if you're familiar with the process. But generally, the recognition process takes up to 12 months. So from the point that you submit the payment up until the end of that 12-month period, which will run you to June 30th, 2020, you'll be working closely with your Navigate coaches and your MCO representatives throughout the recognition process to navigate just putting together your workflows, your operational plans, and all of the evidence and documented processes that you need to submit for evaluation to NCQA. And so we'll provide you with more information about getting started, as well as provide you with more information about Navigate as well, and so they'll be there to help you navigate this NCQA recognition process. But this is the timeline that we've set for WAVE-3 providers for those sites that you'll need to pursue recognition for. So we're looking for you to enroll by May 31st, submit the payment by June 30th, and then over that 12-month time period to work through the recognition process to achieve recognition by June 30th of 2020. And if you are looking for more details, more information, or even to start reviewing the NCQA 2017 standards, the link to those standards are listed on the slide here, as well as in Section 5 of the Provider Operating Manual. All right, so the next section is on payment. So as I mentioned before, in this program, one of the ways in which we support practices is through payments. So as a participating provider in the PCMH program, you will still continue to be paid fee for service. But through this program, we also have 3 other financial streams that we provide for our participating providers. The first is what we call an organization transformation payment. So this is $1 PMPM, it's not risk adjusted, that each organization receives during their first year of participation in the program. And the purpose of this payment is to support your initial investment and just ramp up for this organizational transformation. The second type of payment we provide providers are risk-adjusted PMPM payments. So these are those activity payments that support all of the work and just operational things that we are asking for you to do under this model, such as care coordination and coordinating with behavioral health providers, et cetera. And this payment is just to support those ongoing activities. And the third type of payment that we have in the PCMH program are outcome payments. So these are the payments, you can kind of consider them as a bonus payment. And these payments are meant to reward high-performing providers based upon their performance on the program's quality metrics, efficiency metrics, and their total cost of care. So we actually have 2 different types of outcome payments depending on your panel size that we will get into in the next couple of slides, and we'll walk through how those outcome payments are calculated for those 2 types of payments, one for high volume and then the other one for low volume. So as I said, there are 2 different types of outcome payments for the PCMH program, and it's based upon your panel size. The first are for low volume providers, which are PCMHs who have less than 5,000 members with a given MCO. And then high volume providers are those providers who have 5,000 or more members with a given MCO. So it is possible that one organization may generate an outcome payment as a low volume provider with 1 MCO, and then as a high volume provider with another MCO, because their panel sizes are different for those given MCOs. So in the next couple of slides, we're going to be walking through a step-by-step calculation for these outcome payments for low volume and high volume providers. So in this slide, you'll see the different ways in which we measure quality and efficiency through these outcome payments. Once again, these outcome payments are meant to reward high-performance providers. So in the first step, we're going to be looking at how we measure quality. So for each PCMH organization, they will be measured on a set of quality metrics depending on their designation type, adult, family, pediatric, and they'll be measured on their performance against state set thresholds for a set of quality metrics. And for each of those quality metrics, you have the potential to earn what we call a quality star. That is, if you outperformed a benchmark, you earn a quality star. And then we measure efficiency performance. So we measure this slightly different for low volume versus high volume. For the low volume PCMHs, those are the ones who have less than 5,000 with a given MCO. We have 2 efficiency metrics, that we use to measure efficiency. And we have MCO set thresholds by which we measure those providers' efficiency performance. For the high volume PCMHs, we measure your total cost of care and compare that to other PCMHs' total cost of care. And based upon your performance as a low volume against those efficiency metric thresholds, or if you're high volume, your total cost of care compared to your peers, you may earn stars. And so these stars will go into into the bigger outcome payment formula that we'll walk through in the later slides. And then step 3, we measure efficiency improvement. So this is essentially measuring your efficiency compared to yourself. So for low volume PCMHs, we measure improvement in those 2 efficiency metrics in your current performance to your prior year's performance. For high volume, we measure your actual savings to your total cost of care. And we'll walk through how these are measured in more detail in the slides that are coming up. And then lastly, we roll all of these calculations into the outcome payment formula, and we also factor in a percentage of shared savings. So for low volume PCMHs, they are eligible for up to 25% of shared savings. And for high volume, they are eligible for up to 50% of shared savings. So let's get into the low volume outcome payment formula calculation. So like I said, the first step for calculating the outcome payment is to calculate the PCMH's quality performance. And once again, there are separate core quality metrics for adult, pediatric, and family PCMHs, which we'll review in later slides. But for this example, we're looking at an adult PCMH. And this PCMH obviously may earn stars based upon their performance across those core quality metrics. I also want to let you all know that you are only eligible for an outcome payment if you earn a minimum number of quality stars. So there's a quality gate to be eligible for outcome payment. For adult and pediatric PCMHs, the quality gate is 2 stars. So you must have at least 2 quality stars to be eligible for outcome payment. For family PCMHs, the minimum number of quality stars is 4. So you must need at least 4 quality stars to be eligible for outcome payment. So let's look at this example to see how this provider did on their quality performance. So as you see in this example, this provider has a total of 5 quality metrics that they're measured on, and we see the threshold that they're supposed to be meeting or exceeding. And then we see the number of members who are being measured on each of the individual quality metrics, and we see their performance. And so based upon this example provider's performance, they have earned 3 stars because they have met or exceeded the threshold for 3 of the quality metrics. So did this provider meet the minimum quality gate? They sure did. They got 3 stars, so they're eligible for outcome payment. And each of these quality stars are worth 10%. So keep that in mind because these numbers are going to get plugged in on a later slide. So step 2 is measuring the efficiency performance. So for low volume PCMHs, the efficiency performance is calculated by adding the percentages earned. Sorry, we have a little feedback. Could you all mute your lines, please? All right, thanks. So for low volume PCMHs, efficiency performance is calculated by adding the percentages earned from both efficiency stars and efficiency improvement. So there's 2 components to the efficiency performance piece for the low volume PCMHs. So in this slide, we're looking at the calculation of their efficiency stars. So for this particular provider, they earned 2 stars based upon their performance on these 2 efficiency metrics. These are the 2 efficiency metrics that we have in the program for low volume PCMHs. So it's ED visits per 1,000 member months, and then inpatient discharges per 1,000 member months. So based upon their performance, they earned 2 efficiency stars, and those 2 efficiency stars are worth 15% each. So as you see in the box, we carried over their 3 quality stars from the previous slide, and we've added their efficiency stars from this slide. So in the next slide, we see the second piece of the efficiency performance, which is the efficiency improvement percentage. So this is that measurement piece where a PCMH organization is measured against themselves. So the efficiency improvement percentage is the average improvement in each of those 2 efficiency metrics compared to the previous year's performance for that PCMH. And I want you to note that the average efficiency improvement percentage is capped at positive and negative 20%. So in other words, if your organization sees a decrease in efficiency of 31.25%, it will show a decrease of 20%. So let's look at this example. In this example, The organization saw an increase of 2.69% in their ED utilization, so they actually got more efficient, as well as a 6.67% efficiency increase for the inpatient discharges. And so then those two averages are averaged together, and then that drops into the efficiency performance calculation. So in the previous slide, we saw that they earned 2 efficiency stars, which is 30%, and we see that their average efficiency improvement percentage is 4.68%. So we add those together, and we get 34.68%, and that is their efficiency performance. And so that will be plugged into the outcome payment formula. So here is the outcome payment formula for low-volume PCMHs. So all those calculations we just went through, we're going to be plugging them into this formula. So the first component of the outcome payment formula for the low-volume PCMHs is what we call the average cost of care, PMPM. This is a value that's set by the state, and it represents the average PMPM for PCMH-eligible members across all 3 MCOs. This is then multiplied by the efficiency performance, and as you all remember, the efficiency performance is composed of the efficiency stars as well as the efficiency improvement percentage, which was at 34.68%. And then that is then multiplied by the maximum share savings for low-volume PCMH, which is 25%. And then that is multiplied by the quality stars earned. And so for this provider, they earned 30% from their quality stars. And then that is then multiplied by your member months. So this member months number represents the members on your outcome panel. And I would like to point out that only members who have been attributed at least 9 months to your PCMH are included in this outcome panel. So we multiply all of those values together to get the total outcome payment. And so for this particular provider, they earned a little bit over $65,000 for their outcome payment. All right, so we'll move on to the high volume outcome payment formula. So as in the first step for the low volume PCMH, where the first step is to look at their quality performance. And once again, you know, they have separate core quality metrics for adult, pediatric, and family PCMHs. And you can earn a star based upon your performance on each of the quality metrics compared to the threshold set by the state. So you also still have to meet the quality gauge. So if you're an adult or pediatric provider, you have to have at least 2 quality stars. And if you're a family provider, you have to have at least 4 quality stars. So in this case, this is an adult provider, so they're going to need to have at least 2 quality stars to be eligible for outcome payment. So if we look at the example, we see that this provider actually met the quality gate. They earned 2 quality stars, and each of those quality stars are worth 10%. So the next step, which is different from the low volume for high volume, is that we're going to be measuring their total cost of care relative to other PCPs. So we're looking at PCMHs across the eligible MCO, and we're comparing that particular provider's performance in relation to those of their peers. So the MCO set total cost of care thresholds with guidance from the state for those star designation levels. In this example, we see that this high-volume PCMH earned 3 stars based upon their actual risk-adjusted total cost of care. So they earned 3 stars based upon the star levels for this particular MCO. And so each of these stars that they've earned for their total cost of care are worth 10%. And so as you can see in the box, we carried over the 2 quality stars that they earned at 10%, and we've added the 3 stars that they've earned for their total cost of care at 10%. And so then we compare the total cost of care spend for the high volume. So this is a comparison to themselves. So we are looking to see did this high volume PCMH have a total cost of care savings? So to measure this, we start with a baseline. So the baseline is a 3-year risk-adjusted average total cost of care. And this 3-year risk-adjusted average total cost of care includes the 3 years prior to the calendar years prior to the current performance period. So if you're away from your organization, your current performance period is 2019. So your risk-adjusted baseline will include 2018, 2017, and 2016 spend. And this is averaged. And so that gives you your baseline. And so you take the baseline and then you multiply it by 1% growth rate to get your benchmark. So this is your spending target. This is the value you are trying to spend less than in your performance year. And so then we see the actual total cost of care for this high volume PCMH, and that's calculated based upon your spend for 2019. And so to figure out what the total cost of care savings is, you take the difference between their actual spend and their benchmark spend. For this particular provider, they actually saved $5 total cost of care. And so that value will get plugged into the outcome payment formula at the end. So this is the high volume PCMH outcome payment formula. So in the previous step, we saw that this particular high volume had a $5 total cost of care savings amount. So we put that into the first component. And as mentioned previously, high volume PCMHs are able to share into a maximum shared savings of up to 50%. So that value is populated here. And then we have what we call the outcome savings percentage. So that outcome savings percentage is composed of their quality stars and the total cost of care stars that they earned that we calculated in the previous steps. So for this particular provider, that came up to 50%. And then we have member months. So once again, this represents the members on the outcome panel. And those are the members who have been attributed at least 9 months to the PCMH. So we multiply all of those values together, and this particular provider earned an outcome payment of $75,000. And so those are how the outcome payments are calculated for low and high volume PCMHs. I know that was a lot of information, that was a lot of math, but there are further details in the Provider Operating Manual in Section 6 if you would like to go back and review or just study how those calculations are arrived at. So Section 7, we have a little bit of information about the remediation process. So this is a part of the program design designed to support practices who need additional support. Those practices who are a little delayed in meeting some of the program requirements or not on track with meeting deadlines, et cetera. So a PCMH organization may trigger the remediation process in a few ways. One way is not meeting the program requirement, the NCQA recognition requirement. So not meeting those deadlines or not staying in compliance with your recognition status. Also, just being non-responsive or failing to respond and meet with the MCOs or TennCare. And the MCOs individually have a process whereby which they are working with practices who may fall into a poor quality or efficiency performance category. Full details about the remediation process may be found in Section 7 of the operating manual. All right, so Section 8 details all of those quality metrics I mentioned previously. As I mentioned before, there are a different set of quality metrics for adults, pediatric, and family providers participating in the program. This slide and the next slide lists each of the quality metrics that we are tracking and that we are measuring each of the PCMHs on, as well as the thresholds for those individual metrics. And most of the measures are HEDIS measures, if you're familiar with those. There are a couple of custom measures, but in the appendix of the operating manual, we have more detailed descriptions of each of those metrics. So I would encourage you to review those metrics, as well as when I get to the care coordination tool, I'll talk a little bit about coding reference guides, but we also have some different resources in the care coordination tool with those measure specifications and coding references as well. And then on slide 23, we have those two efficiency metrics that we're using for low volume PCMHs. It's the ambulatory care ED visits as well as the inpatient discharges. And both of those are HEDIS metrics. As I mentioned before, each MCO sets efficiency metric thresholds with guidance from the state. And there are separate thresholds for these efficiency metrics for pediatric organizations versus family and adult practices. So the next section is on risk adjustment. So for the PCMH program, we use risk adjustment for two different areas of the program. The first is for those activity payments. Those are those monthly average $4 PMPMs that you all receive for your members. And those are, we use our risk adjustment system for that. We also risk adjust total cost of care for high volume PCMH organizations. And the software that we use is called the Combined Chronic Illness and Pharmacy Payment System, or CDPS is what we call it. It's a software that we're using to do these risk adjustments. And CDPS combines medical diagnoses and prescription drug data to calculate these risk adjustments. So if you want more information about this risk adjustment software, or just to learn more about how risk adjustment is using the PCMH program, you can refer to Section 9 of the operating manual, as well as we have a previous webinar that we conducted giving more information about this software on our website, and we'll also drop in the links to those webinar slides as well as the webinar recording for your reference. The next is reporting. As I mentioned, we provide data to you all as participants in this program for you all to use for actionable items and for informing your transformation activities and just identifying areas in which you can implement quality improvement projects, et cetera. So one of those sources of data are what we call provider reports. So each quarter, you should expect to receive provider reports. This is at the tax ID level from each MCO that you're contracted with. And these provider reports include efficiency and quality performance information, as well as total cost of care, your potential outcome payments, et cetera. And these quarterly reports are really aimed to provide you with an interim view of your member panels that you're held accountable for during the performance period. So below is a timeline of when you should expect to receive your reports for this year. Your first report that you're going to be receiving is going to be around the end of February, and this will be a preview report that's going to display some of your 2018 data. So it's going to show you how you how you're performing on the program's quality metrics had you been a participant last year. And so be on the lookout for those. Each of the MCOs has a specific portal through which you can access these reports. The next section is Section 11 of the operating manual, still following along, and it's on provider training. So the state has contracted with Navigant. Navigant is a vendor to provide various provider training and technical assistance to each of the PCMH providers. So some of you may have already gotten emails or set up introductory phone calls with Navigant. But one thing Navigant does is they assign on-site coaches to each of the PCMH providers. So the coaches should be reaching out to you to have introductory phone calls to introduce themselves, as well as just to get to know you a little bit better in your organization. And they'll also be talking with you about scheduling initial assessments. So initial assessments are on-site visits where the coaches come on-site and meet with your key staff and those who are going to be working with you all on the PCMH efforts to really identify where your practice is in its transformation and your current capabilities, areas in which you might need additional support, areas in which you are excelling, et cetera. And so based upon this initial assessment, the coaches will then put together a customized coaching plan for you for the year. And, you will work, it's an iterative process. So you will work with the coach hand in hand to make any revisions or anything like that. But the coaching plan is essentially your guidepost and your framework to work with the coaches on your NCQA recognition, different areas of practice transformation over the year to really take on and improve just your operational workflows and your overall transformation. Also, Navigant puts together what we call large format conferences. These are conferences that are held in each region, and it's a time for the providers from PCMH as well as Tennessee HealthLink to come together in each region to have a full day of workshops and networking and really focus on some targeted topics and areas of transformation. It's really a great opportunity to network with providers who have been in a program for a while and new providers, and just to really get oriented to the program and to be able to take valuable information back to your practices to help you to support you in your transformation. And so I've sent out some information that the next set of large format conferences are coming up at the end of February, the 26th, 27th, and 28th, West, Middle, East, respectively. And so more information about registration and the specific topics that are going to be covered in those conferences will be coming out soon. But I'd really strongly encourage you and your staff to attend these conferences because they're very valuable, and they do give you some helpful information and takeaways to help you support you in your practices. And also, it's a good way to network. There's a lot of good cross-pollination of best practices and activities that happen, and even just coordinating across the physical and behavioral health space. As I said, participants from the Tennessee Health Link also jointly attend these sessions. Navigant also puts on smaller regional learning collaboratives. These are more deep targeted collaboratives that they have across different regions, as well as they put on webinars. So they have a lot of informational webinars. A lot of them are already posted on our website, and there is one that's coming up on January 30th on NCQA documented processes and evidence. I've sent out a calendar invite information about that, and I would strongly encourage you to tune into that. We'll also be posting the webinar recording and slides to the website at a later date if you're not able to attend, or if you want to reference it in the future. And another thing I want to point out that Navigant has put together for us is a curriculum. So they've put together a curriculum for PCMH and HealthLink that has valuable information about the different areas of practice transformation. There are resources, there are templates, and the curriculum is set up in a way that mirrors the NCQA concept. So a lot of the information in the curriculum is also helpful and would be very valuable for you to review and use it implementing your practices as you go through the NCQA recognition process. And we'll send out more information about how to get access to that curriculum as well. But these are some of the learning opportunities and training and resources that Navigant gives our providers in this program. So another way in which we provide data to you all is through the care coordination tool, and this is section 12 of the operating manual. So as part of your participation in a program, you will have access to this tool, and it's a platform designed to provide you with useful information about your members that are attributed to you to better coordinate their care. Some of the functionalities of the tool include risk scores, as well as displays of gaps in care on those quality metrics that we have within the program, as well as admissions, discharge, and transfer fees. And I would like to point out that as of December 2018, 97% of the hospitals statewide are sending ADT data that's available in this tool. And the list of all the participating facilities is also available on our CCT webpage, as well as training videos and other helpful resources to get you acclimated and oriented to the tool and help you to identify ways in which you may be able to incorporate this into your workflow and use this in your practices. Also, many of you have probably already received emails from the state, but the state and Altruist, that is the vendor for the care coordination tool, are in the process of credentialing you all to have care coordination tool accounts and logins. So this is a multi-step process to get each of you credentialed, and I think almost the majority of you all have done this first step, which is designating a practice administrator. So thank you all for doing that so quickly. And then I know the request is that you also submit the information for other staff and other practice administrators who would need to get accounts for the care coordination tool. So you should have received emails from that big email address you see there. And if you have not, or you do have some staff members that you would like to get set up, please email that email address so that we can get you all connected. And also just want to let you all know that you can anticipate probably early February, maybe a little later, a series of webinar trainings on the CCT. So we'll be hosting those training sessions for you all and your staff so we can walk through the tool and the different functions and features of it and answer any questions that you have. So be on the lookout for more information and calendar invites about those upcoming training sessions. So on slide 13, I'm not sure if it changed. So slide 13, we have the quality and efficiency metrics appendix. So this is the last section of your operating manual, and this lists, once again, those quality metrics that we have in the program, as well as a short description and the thresholds. And so, as I mentioned before, many of these measures are HEDIS measures, and they follow the most up-to-date HEDIS specifications. And so I also want to point out, once you get access to the care coordination tool, we have coding reference guides with these quality metrics and so forth, and the HEDIS specifications as well for you to be able to access in the knowledge library of the care coordination tool. Also, I just wanted to remind you all that the MCOs set the efficiency threshold for those efficiency metrics, and those metric thresholds should have been provided to you during contracting. And so the last thing, it's not an operating manual, but I wanted to put this on your radar and let you know about this program, is the Medication Therapy Management Pilot Program. So this is a program that was launched January of last year, and it is a voluntary program that reimburses pharmacists for providing MTM services to eligible members in PCMH and HealthLink. And so the pharmacists in this program work directly with members to identify, prevent, and resolve medication-related problems, as well as working with their providers. And the members that this program focuses on are those who have multiple chronic illnesses and medications with a risk stratification of medium, high, or critical, or members who have pediatric asthma or pediatric diabetes. So if you want to know more about the program or just get more information, you can go to the link there, or you can email tencare.mcmpilot@tn.gov for more information. And with that, I know that was a lot of information, so I am going to pause and see if we have any questions or comments. My email address is listed there in the event that you have any questions after today's webinar or just want to say hello and introduce yourself. There is a question that asks how many quality stars for a high-volume pediatric practice. So the quality stars are based upon your designation as an adult pediatric or family practice. So if you are a pediatric practice, you have a total of 5 quality metrics, so you have the potential to earn 5 quality stars. And so to be eligible for outcome payment, you'll have to have at least 2 of those quality stars to be eligible for outcome payment. Okay, so there's a question about seeing more information on the curriculum. And so I will send out more information about how to get access to SharePoint. Actually, I will put in the Navigant contact, which is Christina Rodich. And if you would like to get access to the PCMH curriculum, please just email her, and she can get you all set up and access to the SharePoint where you can access the curriculum. So yes, we will be posting the webinar and webinar recording after today's webinar, and I will send out an email to let you all know when that is live on the website. Any more questions or comments? I'll give you guys a couple more minutes. There is a question, can our members in the CCT, the Care Coordination Tool, be filtered by each provider in our practice? Currently, that is not a feature in the Care Coordination Tool. So that is something we can take back for internal discussion. There is a question about members being included if they have not heard back from an MCO. If you have not executed a contract with for the participating MCO or been in conversation with that MCO to finalize a contract, then those members will not be included unless a contract is executed. Give you guys a couple more seconds. There is a question about payment. A specific question about payment. I will refer you to your MCO representatives for more information about that particular question. There is a question that asks if the care coordination tool allows you to sort by newly assigned members. Good question. Let me take that back internally to confirm, and then we'll circle back with you offline about that response. See, one more question coming in. So there is a question about the NCQA recognition timeline, specifically the payment point. So we are looking for you to submit the payment in QPAS by June 30th for those sites that need to undergo recognition. And as I said, the state is fully sponsoring the recognition process for each of those sites. And the process works where we send you a code that you will have to upload into QPAS. And so that code will basically serve as the payment for those particular sites. We have not released the code yet, but we will let you all know when the code is released and provide instructions on how to use the code as well. All right, well, I'm not seeing any more questions or comments, but thank you all for joining us today. And once again, if you all have any questions or you take this information back and something's a little confusing and you just need clarification, please feel free to reach out to me via email or phone. I'm always happy and available to chat with you. And once again, welcome all the Wave 3 providers. I'm so excited that you're on board, and I hope to see a lot of you at the upcoming conferences. All right, so we're going to hop off, and everyone have a good day.